At this time, I would like to introduce our first speaker, Dr. Michelle Monroe, the interim CEO of the American College of Nurse Midwives. Please, Dr. Monroe. Thank you.
Good afternoon, everyone. As I was introduced, my name is Michelle Monroe, and I'm the Interim Chief Executive Officer at the American College of Nurse Midwives. I want to thank all of you for your leadership and commitment to improving the state of maternal health care in our country. ACNM applauds the Black Maternal Health Caucus for their steadfast commitment to changing systems of oppression like structural racism, which is a key factor for maternal death and illness in people of color in the United States. We must do better to improve maternal mortality and morbidity and address the appalling racial and ethnic disparities, racism, and biases in maternal health care. To that end, I would like to highlight work that ACNM is focused on to improve the culture of maternal health for the people and communities midwives serve. ACNM is the professional association that represents certified nurse midwives and certified midwives in the United States. Our members provide evidence-based midwifery care throughout the lifespan. ACNM works to promote equity, diversity, and inclusion throughout the midwifery profession and across the care continuum to ensure better health care outcomes for the people midwives serve. Improving access to evidence-based midwifery care in all settings helps ensure that all women, birthing people, and babies are served by a maternal health system that delivers safe and effective family-centered care. The midwifery model of care reduces maternal and neonatal mortality, improves outcomes, and has demonstrated higher rates of satisfaction. Midwifery is part of the solution to addressing our nation's maternal health crises. A large part of ACNM's legislative policy mission is to promote and expand access to the midwifery model of care. The United States continues to experience a growing mental health crisis and maternal health crisis, with many people residing in maternity care deserts. Additionally, people of color are not able to access maternity care providers who look like them. Building a cultural competent healthcare system that meets social, cultural, and linguistic need of pregnant and birthing people can help improve health outcomes and quality of care, and can contribute to the elimination of racial and ethnic health disparities. Despite the role midwives could play in efforts to reduce maternal mortality and morbidity, midwives and the midwifery model of care remain drastically underutilized in the United States health system. ACNM is working to address many of these barriers, and we would like to thank the Black Maternal Health Caucus for establishing grant funding for midwifery education programs to help diversify the workforce in the Perinatal Workforce Act, one of the 13 pieces of legislation that make up the Black Maternal Health Omnibus Act. ACNM has also worked with Congress to secure over $25 million in federal grant funding for midwifery education through annual appropriations. This is a setting precedent with a larger goal of establishing a permanent funding stream to increase the number of nationally certified midwives in the United States, being passage of the Midwives for Maximizing Optimal Maternity Service Act, also known as Midwives for Moms. Introducing in both the House and the Senate, the Midwives for Moms Act, H.R. 3768, and Senate Bill 1851, establishes two new funding streams under Title VII, Health Professions and Training Programs, and Title VIII, the Nursing Workforce Development Programs of the Public Health Service Act, specifically for accredited midwifery education programs. The Midwife for Moms Act aims to increase the number of midwives educated by accredited midwifery programs through a Health Resources and Services Administration grant program that will directly support student midwives, establish and expand midwifery programs, including within historically Black colleges and universities and other minority-serving institutions. and ensure support for increasing the number of preceptors at clinical sites to mentor students training to become midwives. The legislation takes deliberate steps to address the health disparities and disproportionately impact Black, Brown, and Indigenous mothers and pregnant and birthing people by prioritizing grant funding to midwifery programs that effectively demonstrate a focus on strengthening and increasing racial and ethnic representation with the goal of creating a more diverse and equitable midwifery workforce. Additionally, ACNM started the Access to Equity in Midwifery Education and Care project to try to increase recruitment, retention, and graduation of midwives of color. We have a dual approach, working to improve existing programs as well as reaching out to historically Black colleges and universities to facilitate discussion about the benefits of midwifery and to generate interest in starting education programs. Thank you very much for this opportunity to discuss ACNM's initiatives and ideas for improving mental health, maternal health. We are committed to working with Black Maternal Health Caucus and the 118th Congress to bring about positive change in our country's health system. Thank you.
Yes, thank you so much, Dr. Monroe. Our next speaker is Rebecca Lara, a manager of federal affairs at the American College of Obstetricians and Gynecologists. Thank you.
Good afternoon. My name is Rebecca Lauer, and I'm on the federal affairs team at the American College of Obstetricians and Gynecologists, or ACOG, the premier professional membership organization for OBGYNs. I'm proud of the work our organization and this caucus have done together on addressing the maternal mortality crisis and improving maternal health outcomes, particularly for moms of color. However, if we are going to get the Momnibus over the finish line, we'll need more bipartisan support, particularly in the Senate. One way to build this support is through robust stakeholder engagement directly with senators and their staff. At ACOG, we routinely leverage the voices of our 62,000 members to achieve our policy goals. Through meetings and written communications with representatives, ACOG OBGYNs share their personal, real-world stories on the impacts of policies on their own practices and their own patients, at times to great effect. On the ground, constituent advocates are always amongst the very best tools any organization has. Lawmakers often need to hear personal anecdotes before they truly understand a problem and commit to finding solutions. Emails, letters, and virtual meetings are therefore excellent ways for stakeholders to communicate with their senators about how the Momnibus would specifically improve their own lives and the lives of other new parents in their states. There's also an opportunity to expand upon the Momnibus as we emerge from the pandemic and reflect upon the lessons learned. Right now, states are going through their Medicaid rolls and terminating the benefits of those who are no longer eligible. States were prohibited from removing anyone from Medicaid during the public health emergency, but now that it's over, millions stand to lose coverage. And the main reason people are losing their Medicaid coverage is actually due to procedural reasons, like not receiving the renewal notice in the mail, rather than receiving a boost in income. And among the people being improperly terminated from their Medicaid benefits are pregnant and postpartum people. We all know how critically important health coverage is during pregnancy and the months that follow, and how lack of coverage contributes to poor maternal health outcomes during a time of rising maternal mortality. It is important that we learn from the flawed current Medicaid unwinding process that is leaving too many of the most vulnerable without coverage. Legislation examining the flaws in this current unwinding process so that we are better prepared for an unwinding after a future public health emergency should be considered in a future Momnibus. Such an examination should include a focus on how pregnant and postpartum people in particular have lost coverage and how to minimize such losses in the future. Thank you so much for your time. I look forward to implementing these ideas and strategies.
Thank you, Rebecca. Our next speaker will be Samuel Hewitt, Principal of Federal Affairs at the American Nurses Association.
Thank you. Hello, as she just said, my name is Sam Hewitt, and I'm here representing the American Nurses Association, also known as ANA. We're thankful for Congressman Underwood and Congresswoman Adams for bringing us all together today for this very important summit. ANA, just so you all know, is the premier organization representing the interests of the nation's more than 5 million registered nurses through its constituent and state nurses associations, organizational affiliates, and individual members. ANA members also include those practicing in the 4 advanced practice registered nursing roles, including nurse practitioners, clinical nurse specialists, certified registered nurse anesthetists, as well as certified nurse midwives. This omnibus legislation seeks to strengthen access to maternal care, particularly in underserved communities where maternal mortality rates are disproportionately high. The legislation also supports the training and recruitment of a diverse perinatal workforce, including nurse midwives, RNs, and other healthcare professionals, ensuring that every mother receives the culturally congruent maternity care and support she deserves during pregnancy and childbirth. Last year, on June 11th, 2022, the ANA Membership Assembly, the governing body and official voting body of the American Nurses Association, took a historic action to begin a journey of racial reckoning by unanimously voting yes to adopt the ANA Racial Reckoning Statement. The Racial Reckoning Statement underscores the pressing need for change in our approach to healthcare, specifically in addressing racial inequalities and maternal outcomes. The statement is a first step for the association to acknowledge its own past actions that have negatively impacted nurses of color, as well as perpetuated systemic racism. In order to move this omnibus legislation forward, ANA believes we want to identify and highlight similarities and challenges that different underserved communities face in this country when it comes to healthcare disparities and social determinants of health. By focusing on our similarities instead of our differences, we can build bridges of understanding and empathy that unite us and make progress together. For future legislation, ANA is looking at a plethora of things that could help reduce disparities in healthcare, especially in maternity care. One of the things that we're starting to look at is artificial intelligence and how that affects healthcare. We want to make sure this technology that was used for good and does not exacerbate disparities within those communities. You've seen this with facial recognition technology where it does not correctly identify people of color and things like that. We want to make sure the laws and regulations are in place so that we do this properly because it is coming and Congress needs to step up. Some of the other programs that ANA is strongly supporting is the minority fellowship programs. These are very important in getting more people of ethnic and diverse backgrounds into behavioral health jobs in this country. ANA, full disclosure, is a grantee organization, but we want more robust funding for that program. It's extremely important. It trains about 400 different providers each year. And finally, the Title VIII nursing workforce development programs, especially that diversity grant to get more diverse people into nursing, is very important to ANA and nurses everywhere. We were very happy with the Senate's latest package, and we hope that the House continues to fully fund this robust program, especially to the appropriators out
there. Thank you, Sam. I would now like to introduce Terence Moore, the CEO of the Association of Maternal and Child Health Programs.
Good afternoon, everybody. I want to bid you greetings from the Association of Maternal and Child Health Programs. It has the distinction of being the country's oldest public health statute establishing the Title V programs. Title V programs exist in each of the 50 states and the 9 U.S. territories, specifically designed to provide services to women, children, and families around the U.S. We are particularly concerned about what we have all been discussing all day, which is the sort of robust and unrelenting maternal mortality data that we have seen around the country. But I come to also reiterate what we've heard today, which is hope. Hope that the efforts that our wonderful champion in Congress, multiple champions in Congress are leading, Congresswoman Underwood, as well as Congresswoman Alma Adams as well, and we are excited with the Senate partners as well as we continue to move forward in the right directions. So I wanted to share a few things that we have been excited about in terms of achievements on the Preventing Maternal Death Reauthorization Act and the PREMIE Act that was passed out of Energy and Commerce just on July 19th. AMCHIP has played a leading role around organizational letters and support for reauthorization efforts, recent legislation to protect pregnant and postpartum people in the workplace, the Pregnant Workers Fairness Act, and the Pump for Nursing Mothers. And we know that attention must continue to be paid toward maternal mental health, the Triumph Act as well. While we, as the last couple speakers have mentioned, are concerned about the unwinding of Medicaid benefits around the country, as Administrator Shakita Brooks-LaSure mentioned earlier, we continue to simultaneously see more states pass postpartum Medicaid extension. And so we know as advocates we have lots of work to do to educate state legislatures and members of Congress around the country. In terms of recommendations for future legislation to build on Monobus, our team has come up with a list, and we're happy to provide a deeper dive and letters to you all, but cross silos to make coordination and collaboration better across disciplines. We heard a little bit about that in panels this morning, really breaking down silos, extending the concentric circles. We know that health programs are one thing. We know that the social support networks are necessary, whether it's food, clean air and water, et cetera. And so really interested in cross-disciplinary efforts, legislation there. We often think about equity in terms of race and ethnicity. We know it's particularly important. Also wanting to make sure that we are thinking about rural maternal health as well. Recognition that in every zip code we have challenges and there are opportunities and ways to message these profound problems around the country across zip codes. I'd be remiss if I did not mention how we can really lift up and support birthing people with disabilities in this country. When we talk about the intersections of issues, profound issues that rarely get attention, another area as well. And then finally, addressing social determinants and underlying causes, Paycheck Fairness Act, and garnering attention in birth equity space. But I leave you today by saying, let's imagine a world where birthing people in every zip code in this country can have access in the early months during culturally competent care, that they're able to access this care within reaching distance of their homes, that they have safe communities that are free from violence, and that they're able to have a pleasurable, affirming birth experience where they're acknowledged for their humanity and the individuals that they are. This is an achievable thing in our country. I know all of you out there are doing the yeoman's task in ensuring that that is happening, and I too think it's a possibility, so thank you all.
Thank you, Terence, for those words. Next, I would like to invite to the stage Brianna Lipscomb, Senior Advisor for Maternal Health and Rights at the Center for Reproductive Rights.
Thank you for that introduction. There we go. Okay. I'm Brianna Lipscomb, Senior Advisor of Maternal Health and Rights at the Center for Reproductive Rights. For those that don't know, the Center is a global legal advocacy organization that uses the power of law to advance reproductive rights as fundamental human rights across the world. Our three broad maternal health policy priorities focus on improved data quality, availability and accessibility of that data, expanded access to care, and elimination of racism both within and beyond the healthcare system. And so first, I must applaud the Black Maternal Health Caucus for yet another comprehensive bill package that aims to eliminate and address the inequities in our healthcare system. And when Congress passes the Omnibus package, it's going to have an incredible impact on Black families across the U.S. And yet, there's always more that Congress can do to help improve maternal health. And so as we're thinking ahead to the next phase of legislation and what more can be done, I must amplify the policy change that our community partners are saying that they need. Our partners are telling us that some states are still struggling to extend Medicaid coverage to 12 months postpartum. We need mandatory coverage in all 50 states. Our partners are also telling us that skilled midwives that have gone through extensive training and integrated deeply valued cultural practices into the care they provide in their own communities are being shut out of the maternity care workforce based on racist, harmful, antiquated beliefs and laws. We need federal acknowledgement of and support for direct entry midwives, both traditional and certified professional midwives, as skilled providers of maternity care. And our partners are telling us that military moms are wanting to birth with midwives in their home environments, and that TRICARE makes it very difficult to cover that culturally congruent, safe maternity care. At a minimum, TRICARE should be covering providers that are legally permitted to practice in a state where a military family is residing and serving our country. Finally, as we continue to witness the attack on abortion rights across this country, we must bridge conversations of abortion rights and maternal rights, even in this split Congress. To the extent that state abortion bans and restrictions have exceptions for dangerous pregnancy complications, the experiences of pregnant people in states like Georgia, Texas, Tennessee, Louisiana, Florida, I could go on with the list of states. The pregnant people are saying they're not actually receiving the care they need in those areas. And I want to add that these laws forcing people to carry a pregnancy is putting further strain on severe maternity care deserts and a system that is already failing to protect the health and life of Black and Indigenous pregnant people. We need federal protection for abortion access. And I'll leave you with this. Abortion bans and restrictions extend beyond one's decision about whether to have a child or not to have a child, but they also present threats to autonomous decision-making about the birthing experiences for wanted pregnancies. Restrictive abortion laws continue forcing us down a path where pregnancy is viewed as situations to manage and bodies to control, and we must fight against the long legacy of reproductive oppression in this country. And the Center believes that Congress and the Black Maternal Health Caucus can work alongside us in that fight. Thank you.
Thank you, Brianna. Our next speaker will be Cecile Christie, the Director of the Gender, Equity, and Health Justice Program at Community Catalyst.
Good afternoon, everyone. My name is Cecile Christie, and I'm with Community Catalyst. Today, I want to talk to you about the national maternal health crisis affecting our Black communities across the country. It's not enough to simply acknowledge the crisis. We need to take action with race equity forward solutions that focus on the experiences, expertise, and ideas of impacted communities. Only then can we ensure that Black people receive the health care that they want, need, and deserve. Because when Black women and communities thrive, we all thrive. As the director of the Gender, Equity, and Health Justice Program at Community Catalyst, I'm honored to be here today to share our vision for a nation where everyone, regardless of race, sexual orientation, or economics, has what they need to be healthy. But before we can move forward, we need to understand where we've been. The US health system is built on inequity, and this is especially true for Black women in America who often struggle to get culturally appropriate and compassionate care and face judgment, fear, denial, or debt when seeking medical attention. It doesn't have to be this way, however. The Omnibus offers an alternative vision for America, a vision where Black women and families are treated with dignity and respect in and out of healthcare settings. It's a world where we have the freedom to seek care from doctors, midwives, doulas, community health workers, and other medical providers of our choice without going into debt. It's time for the Senate to listen to the millions of voices nationwide who have been continuously expressing public support and awareness for the omnibus legislation. In order to increase bipartisan support, more organizations in the broader health justice movement must join forces with those of us working in reproductive health spaces to demand action. Not only can we win, but we will. Beyond the necessity of the Momnibus, we urge policymakers to explore the impact of long COVID on Black maternal health in the Momnibus 2.0 legislative package. We need dedicated funding for community-based organizations and federally qualified health centers for long COVID outreach, education, and support to pregnant, birthing people and women of reproductive age. For far too many, the impacts of COVID on our lives continues. Data have shown that most Black women get their COVID information from social media and the news, and yet there is a big gap in information and resources available related to long COVID. We want that to change. Congress must increase funding to support state and local modified medical research council work and initiatives and mandate that data is made more readily available so that robust research and analysis is done to better understand the impacts of long COVID and what it does to pregnancy-related deaths, and importantly, if pregnancy-related deaths are preventable. We must also ensure Medicaid and private insurance coverage of long COVID, specialized rehabilitative services such as complementary and alternative medicine, physical therapy, or pulmonary rehab with a provider of the patient's choice. These bold policy changes and strategies are rooted in leadership and the perspective of the people most harmed by today's health system. Congress, as well as the Biden administration, has a unique opportunity to act, and we must push them to do so. So thank you for having me here today and for your continued attention and action to these critical issues. Together, we can create a world where everyone has what they need to be healthy and thrive.
Thank you so much, Cavell. I would now like to introduce the founder of Every Mother Counts, Christy Turlington Burns.
Thank you so much. I just wanted to start by thanking Representative Underwood and Representative Adams, your leadership on the Black Maternal Health Caucus and your efforts to drive change on maternal health for all people in the United States, especially for Black women and birthing people, is inspiring. I'm honored to join you and so many committed leaders today. My name is Christy Turlington Burns, and I'm the founder and president of Every Mother Counts. Every Mother Counts is a nonprofit organization that seeks to make pregnancy and childbirth safe, respectful, and equitable for every mother everywhere. We advance maternal health in the U.S. and globally by raising awareness through education and storytelling, investing in community-based solutions through grant making, and advocating for critical policy change. As we have already heard many times today, we have more evidence than ever that the U.S. is facing a maternal health crisis, with stark and persistent inequities in outcomes and experiences of care. It's time to move to immediate and sustainable action, and passing the Momnibus is key to this action. Today, Every Mother Counts is proud to join the calls to pass the Momnibus. In this vein, we offer 2 recommendations for building bipartisan congressional support and momentum. First, we believe that advocacy for maternal health is most powerful when it centers the voices of mothers and birthing people. We recommend that individuals who nearly lost their life during childbirth or experienced mistreatment during their care, as well as families impacted by pregnancy or childbirth complications, be given the opportunity to testify. We need to elevate the stories behind the statistics by listening to Black women and all birthing people. And second, we call for Congress to meaningfully engage and partner closely with community-based organizations working to advance maternal health and birth equity to ensure that the most representative voices not only have a place at the table, but are leading these conversations. It is critical to support grassroots, community-led efforts to hold Congress accountable for passing the Momnibus. Furthermore, Every Mother Counts has several recommendations for future legislation to build on the Momnibus. First, create a Black maternal health agenda that is comprehensive and incorporates other critical and complementary pieces of maternal health legislation, including the Mommies Act, Midwives for Moms Act, and the Babies Act. Second, integrate midwives effectively into the maternity care system. This includes ensuring that midwives are reimbursed by Medicaid at 100% of physician rates for identical services in all states. Third, increase access to community birth options for healthy, low-risk pregnancies, including guaranteeing Medicaid coverage of birth center fees for both mother and newborn. And finally, fourth, to ensure that all 50 states provide Medicaid coverage for a full year postpartum. Thank you again to the Black Maternal Health Caucus. Every Mother Counts is grateful to be working by your side.
Thank you, Christy. Our next speaker is Mackenzie Marshall, Manager of Federal Relations at Families USA.
Thank you. My face is so large. It's like the largest I've ever seen myself. Hi everyone. My name is Mackenzie Marshall. I'm the Manager of Federal Relations at Families USA. Families is a leading national nonpartisan voice for healthcare consumers, and we're dedicated to achieving high-quality, affordable healthcare and greater health for all. Thank you so much to Representatives Underwood, Adams, and Jack. Big shout out to Jack for inviting me and my colleagues to join today. As we all know, it's challenging to push progressive legislation in a divided Congress. And it's important to acknowledge that the lead sponsors in the House and the Senate have made impressive progress since the initial introduction in 2020. But I think it's time to change things up a little bit. Families USA has always worked hard to keep a bank of consumer stories, and I believe we need to do the same for the Momnibus. We should work to identify organizations in key states who may benefit from receiving grants established through the Momnibus, and individuals who work for those organizations and have on-the-ground experience should be encouraged to share their stories with their congressperson or in the story bank. There should be an emphasis on several main talking points. Delayed care during the COVID-19 pandemic increased our national maternal mortality rate by 40% from 2020 to 2021. States are facing a significant healthcare workforce shortage and rural maternity ward closures, which is of interest to the Senate Health Committee. The Momnibus will help build and strengthen the perinatal workforce, which may help to fill the physician workforce gap and increase access to care in rural areas. And third, maternal morbidity is a substantial economic burden for our nation and its families. In 2021, the Commonwealth Fund published an issue brief which estimated that the total maternal morbidity cost for all U.S. births in 2019 to be $32.3 billion from conception through the child's 5th birthday. That's an additional $8,634 to society for each maternal child pair. The cost comes from hospital stays, C-sections, productivity loss, and more. The upfront cost of the Momnibus will help positively impact these outcomes. And finally, talking points aside, there are hundreds of wonderful organizations who support this package, many of those in this room today. We need to be strategic about which organizations are conducting targeted outreach for the best possible impact. Families has several suggestions for future Momnibus legislation. We've been hearing from doulas through our Maternal Health Innovation Learning Collaborative, or MILC, that the high cost of doula certification is a significant barrier. We'd like to build on the existing perinatal workforce section to provide specific funding stream for doula certification. We also want to uplift the importance of evidence-based home visiting programs, which start during the perinatal period and aim to address a broad range of health and developmental outcomes. Results from home visiting models have shown lower rates of pregnancy-induced hypertension and fewer depressive symptoms for prenatal patients, which are the two of the leading causes of maternal mortality and morbidity in the United States. And in the United States, women with low-risk pregnancies who give birth at home or in birth centers compared to those who have chosen a hospital birth have consistently lower rates of intervention and intervention-related maternal complications. We'd like the Momnibus 2.0 to include a federally funded Medicaid demonstration program focused on freestanding birth centers in order to develop innovative and sustainable payment models for low-risk maternity care. In summation, we need to make sure to connect state and local community partners with federal policymakers to demonstrate the importance of investments in maternal health, and we need sharper advocacy strategies to ensure that every lawmaker who claims to care about pregnant people and babies is educated about the crisis and is on the record of supporting the Momnibus. Thank you.
Thank you so much, Mackenzie. I'm now pleased to introduce Aza Naderi, the Executive Director and co-founder of Mama Toto Village.
Hello again. So a little bit about Mama Toto Village. We are a Black-led maternal health organization that creates career pathways for Black women in maternal health and provides accessible perinatal support services designed to equip women and birthing people with the necessary tools to make the most informed decisions in their maternity care, parenting, and lives. And we are located right here in the heart of Ward 7 in the District of Columbia. So today I stand before you to ask you, to compel you to act with urgency in the interest of Black women, birthing people, children, and families. James Baldwin stated that if one really wishes to know how justice is administered in the country, one does not question the protected members. One goes to the unprotected, those precisely who need the law's protection most, and listens to their testimony. So today, I urge you to hear our testimonies, to hear the stories and suggestions of myself and many of my colleagues, and stop requiring us, as we have for so many years, to beg for our lives, to beg for justice, safety, respect, and dignity in healthcare, and for safety net resources. Bipartisanship around maternal health is an opportunity to center the humanity of Black women and birthing people, because getting it right for Black women means that we get it right for all women. Raise your hand if a woman or birthing person gave birth to you. All right, so no one here is an alien. All right. Because motherhood is bipartisan. It should not be political. And we all came from a mother, no matter the nuances of that relationship or the circumstances a woman gave birth to us. So in this time of great division, what is the best way to build connection? Is through relationship, is through stories. And over the past few years, stories have compelled us to act. Stories in this space have struck emotional chords and have led us to change. It has changed the way that we think about maternal health, how we talk about maternal health. It has shifted culture in so many different ways, and storytelling has the power to shape public policy. And I would like to see more of this in all places and spaces, talking across the aisle, telling a story that has the potential to compel one to action. That we need to hear more raw, unedited stories of the experiences of not just Black women and birthing people, but their partners and grandparents and aunties, and those who want to hear about giving birth in this country, living in this country, navigating healthcare, and raising children in this country. Future recommendations as we think about what else beyond the Momnibus, I would like to see future legislation around breast cancer. According to Breast Cancer Research Foundation, Black women are disproportionately affected by more aggressive subtypes, such as triple-negative breast cancer and inflammatory breast cancer, and they are more likely to be diagnosed at younger ages and at more advanced stages, which impacts their reproductive capacity. I would also like to see legislation support families who are experiencing maternal death and severe morbidity and obstetric harm. So when we're reviewing cases in DC around maternal morbidity and mortality, we often ask what happened to the children and the partners. Did they get any support? And the answer is often silence. The cost of maternal death is immeasurable, and families and partners and siblings are often left behind to shoulder the financial and emotional burden. And lastly, for my amazing lactation team, we would like to see expanded lactation policy, expanding baby-friendly designation to areas beyond the hospital, and supporting states in expanded designated breastfeeding areas. Thank you.
Thank you, Aza. Next up, we have Yulia Labco, the Policy and Advocacy Director at March for Moms.
Good afternoon, everyone. Thank you to the Black Maternal Health Caucus for hosting this stakeholder summit. Really grateful to be here and represent March for Moms. As you've heard, my name is Yulia Labco. I'm a certified nurse midwife, and I'm the Policy and Advocacy Director for March for Moms. We are a nonpartisan, solution-oriented, multi-stakeholder nonprofit, and we focus on raising awareness and addressing maternal morbidity and mortality in the U.S. We convene national stakeholders to speak a common voice and urge policymakers, along with other American leaders, to ensure families get the support and care they deserve. We truly believe that every person should be able to grow their family with dignity. March for Moms, of course, fully supports the reintroduction of the Momnibus, but we also recommend the following to ensure its passage during this Congress. We would like to see an emphasis on engaging individual constituents, which we've all talked about here already today, and of course, community-based organizations. We want to see this mostly in areas that are greatly affected by the maternal health crisis, such as the southeastern United States and Alaska. As a consumer-based organization, we've witnessed much success from grassroots efforts and everyday voters to elevate issues that are not and should not be partisan. One good example of that, which is probably familiar to many people in the room, is the Preventing Maternal Deaths Act of 2018. This was largely passed from the push of constituents and many advocates in this room, and serves as a good blueprint as to how to move this legislation forward. The Black maternal health crisis affects all of our communities, and we must engage as many families as possible to elevate the importance of this legislation. We also recommend partnering with industry partners and leaders, such as businesses listed in the Fortune 500. American moms and families are the pillars of our economy, and they span across all industries. It's imperative that we involve and garner the support of businesses to address this crisis, because they're greatly impacted by the consequences of inadequate support policies and health setbacks of their employees. The Momnibus is just the beginning for families, and in order to build upon existing legislation, we also propose addressing disparities in gynecologic care for Black women. We consistently see pain and other health concerns be ignored and dismissed in healthcare settings, which leads to worse health outcomes and complications that affect the whole family. We call for a public health campaign similar to that of the CDC's Hear Her campaign, and apply that to the gynecologic concerns that women often bring up in their provider setting. We also want to continue to expand bias training beyond state lines and begin to work to address racism in obstetrics, midwifery, and the nursing workforce. We, of course, want to continue to increase the number of BIPOC providers and staff by supporting and continuing to appropriate existing educational funding opportunities and grants. Again, I would like to thank both Congresswoman Underwood and Adams for having us today, and we're really grateful to be a part of this day. Thank you.
Thank you so much, Julia. Our next speaker is Stacey Brayboy, Senior Vice President for Public Policy and Government Affairs at March of Dimes.
So good afternoon, everyone. It's been a phenomenal day for me to just be in this room of awesomeness and take in all of the comments and the great ideas that have been shared from all of you who've worked in this space. And so just want to say thank you for letting me learn and partner with all of you. And thank you, Congresswoman Underwood, and also Congresswoman Adams for hosting this and having us have March of Dimes have the opportunity to participate. March of Dimes is an organization that has been around for 85 years. And we focus on the health of moms and babies. And so ideas or thoughts that I want to leave with all of you as it relates to ideas for supporting the Momnibus in a divided Congress, and with the particular focus on the Senate. I think we all collectively have heard, and we will all agree, that we need to better engage and activate not only our mothers, but also our fathers. And we need to involve various organizations so that we can talk about the power of advocacy and engagement. We've heard earlier about the need for grassroots mobilization. I think we've got to focus on our young people. I think we've got to bring them into this conversation so that they understand why it's important to be able to hold our officials accountable. Keeping in mind that many of our congressional members return back home during recess and at various times during the year, I encourage you to have those individuals to hold our elected officials accountable. Stress to them why it's important for them to help us to be able not only to pass this legislation in the House, but also to pass this legislation in the Senate. I encourage you all, not only starting with the people in this room and you telling 5 other people or members of other organizations, I also encourage you to encourage those people to have conversations with their elected officials, with their state elected officials as well. We've got to address this at both the state and at the federal level. I'd also like to encourage you, how do we push this forward? We've got to continue to support those legislators that we know are on the front line fighting for this act, that is, support them. Tweet about them, share the information that you're getting in your inbox about the wonderful and magnificent things that they're doing every day to be able to support the Momnibus and being able to engage and move this forward. So we've got to help them continue to help us. And what would be my second recommendation, but not mine personally, but March of Dimes' recommendation, is we've got to continue to promote maternal vaccines in the light of declining vaccination rates in many parts of the country. We've got to promote prevention programs to combat poor preterm births and stillbirth rates continuing to impact minorities at a drastically higher rates. We've got to continue to address the maternity care deserts that are impacting 5.6 million moms and babies and families. And we've got to promote telehealth and building and continuing to build on workforce by supporting midwives and our doulas. And what I would encourage everyone to do, together we can do this, continue to build on the support of our moms and our active duty veterans and our active duty military. They've served our nation, and they deserve every protection for their moms and for the duty we can offer them in return. And again, I challenge all of you, leave this summit today making 2 new friends and encouraging those 2 new friends to go back and hold our elected officials accountable in the Senate and support those elected officials who are leading as champions, as Congresswoman Underwood. Thank you.
Thank you, Stacey. I love that, make new friends. Next up, we have Tina Sherman, Senior Campaign Director at Moms Rising.
Good afternoon, everyone. Again, I'm Tina Sherman, Senior Campaign Director at Moms Rising, the national online and on-the-ground organization of more than 1 million mothers, parents, and families across the country. For those of you who don't know, today is the first day of National Breastfeeding Month. And this National Breastfeeding Month, we have huge things to celebrate, including the Pregnant Workers Fairness Act and the Pump for Nursing Mothers Act, providing new legal protections for nursing people and workers across the country. So I think we need to take a moment and celebrate that. So Moms Rising is committed to ensuring that all people have access to quality, affordable reproductive and maternal coverage and care. I don't have to tell any of you we are currently very far from meeting that goal. Maternal health is truly a public health emergency, and this issue is very personal to me. I'm a mom who has personally experienced the shortcomings in our maternal healthcare system, a doula who who works to support and protect other parents, and an advocate fighting to improve maternal health. I have 4 children from 3 births. With each birth, my needs, preferences, choices were ignored. With each birth, I was pressured, even bullied from providers, and with each birth, my experience was far from optimal, much more traumatic than it needed to be. My doctor suggested that my baby would die if I failed to comply with his advice. You know that anxiety that first-time mothers feel without any sort of added additional support? It was absolutely terrifying. My second birth were twins. They were Momo twins, very high-risk pregnancy. Because there was some significant risk associated with the delivery, I did a lot of research. I wanted to be sure I was informed so I could be a real partner in making my healthcare decisions. But when I spoke up, my doctor asked why I didn't want to do what was best for my babies. It was like emotional blackmail. With my last birth, I told my obstetrician beforehand about all of my earlier experiences and how important communication was with me. I'm a little demanding in that way. Still, I had to send him out of the room during labor before he would talk to me instead of at me. I'm happy to tell you that I have 4 healthy children, one rising senior in high school, but I see these problems time and again with my doula clients and with our Moms Rising members. We hear from moms and birthing people across the country who've had difficult, sometimes dangerous birth experiences that were completely unavoidable. There's Mary Ann, who hemorrhaged after a C-section, passing a grapefruit-sized clot, but was still waiting 7 hours for exploratory surgery after giving birth. And Tamika, who was not given a simple urine test that would have led doctors to diagnose the HELP syndrome. Instead, she needed multiple surgeries, went into a coma, and nearly died. I believe that change and education begins with the advocacy. I am proud to serve on the North Carolina Maternal Mortality Review Committee, where we dig deep into every maternal death and share what we learn. My hope is that providers and everyone who works with birthing people will listen and make commitment to change. We want to ensure that our elected officials in the House and the Senate hear and understand what birthing families across the country are encountering. Moms Rising wants to help our members and families tell their stories, focusing on senators who are likely our allies, already have signed on to the Momnibus, who just need a little bit more urging to champion a little harder and help us get this past the finish line. And then we also really want to work on those who come from states who may not normally align with us, but who carry the heaviest burden of the highest maternal mortality and morbidity rates. We want to see continued access. The fact that we don't have all 50 states with Medicaid postpartum coverage is clearly a problem. And we must also continue to promote health equity and anti-racist measures, digging deep to address the very real impacts of implicit bias. We need equal access to best practices and shared plans for childbirth emergencies for all doctors and hospitals, along with training throughout the healthcare delivery system. I'm so grateful to be in this room with all of you and so many others outside of this room who are committed to improving maternal health in the U.S. I am certain that together we can make pregnancy, childbirth, and the postpartum period safer for all women and birthing people. We have no other urgent priority. Thank you.
Thank you, Tina. I'd now like to introduce Venecia Gray, Senior Manager for Maternal and Infant Health at the National Partnership for Women and Families.
Good afternoon. Can you hear me now? All right, that's a trick. Thank you to the Black Maternal Health Caucus for this critical discussion. My name is Venecia Gray, she, her, y'all. I am the Senior Manager for Maternal and Infant Health at the National Partnership, and I'm a mom, and a Southern mom at that. We know our maternity care system fails to provide equitable, respectful, culturally centered, safe, effective, and affordable care. It fails communities that are forced to be resilient in the face of structural and systemic racism, sexism, misogynoir, and other forms of inequity. At the National Partnership, we work to advance gender and racial equity, promote reproductive health, freedom, and justice, and work to reduce the inequities in healthcare. So solving the maternal health crisis is a nonpartisan issue for us. The partnership considers the Momnibus must-pass legislation. We are grateful to the Black Maternal Health Caucuses, who continues to center the voices of those who are most impacted and recommend continued calls for hearings on the Momnibus in both the House and the Senate to amplify the ongoing Black maternal health crisis, to show plainly the Momnibus offers multifaceted solutions that communities themselves want and need and are begging for. Unfortunately, we know in the current climate that cost is often a barrier to many pieces of legislation, but we believe that the cost of Black mothers dying is too high to be insurmountable. The federal investments included in the Momnibus are targeted and effective and will spark the necessary changes. And there is a lot of bipartisan energy around maternal health policy, and we believe strongly that the Momnibus should be the top bipartisan priority for any and all maternal health legislation. In future Momnibus vehicles, we recommend alternative payment models that integrate health equity-centered care design, payment mechanisms, and performance measurement, and to ensure everyone can obtain the maternal care they need, consider legislation requiring all forms of health insurance to cover the full range of reproductive health services, including preconception care, contraception, fertility treatment, and abortion care. It's health care. And finally, continuing to address the social drivers of health that impact Black people of childbearing age, including a national paid family and medical leave policy and minimum wage standards that provide a living wage. Thank you so much for your attention in this timely conversation. Thanks.
Thank you, Venecia. I'd now like to call up Adrian Ramcharin, Assistant Director for State Policy at Physicians for Reproductive Health.
Good afternoon, everyone. Thank you, Congresswoman Underwood, and to the Black Maternal Health Caucus for bringing us together today. My name is Adrian Ramcharin. I use she, her pronouns, and I'm the Assistant Director for State Policy at Physicians for Reproductive Health. For those who don't know, PRH is a national organization representing over 500 physicians across the U.S. working to advance sexual and reproductive health rights and justice. As we've heard today, the U.S. is facing an ongoing and worsening maternal health crisis. We're simultaneously experiencing a rollback on access to the full spectrum of reproductive health care. For decades, policymakers have chipped away at access to abortion care, and now 14 states have banned abortion and many others impose heavy restrictions. Maternal health and abortion access are not siloed issues. Abortion bans force people to remain pregnant, and while most people will have a healthy pregnancy, we also know that it can cause serious health problems and complicate or worsen existing conditions, which can unfortunately result in death. A nationwide abortion ban would increase overall maternal deaths by 24%, and for Black women, this number would jump to 39%. PRH believes it's important that we address access to abortion care in tandem with the maternal health crisis because these issues are one and the same. The providers in PRH's network care for pregnant and postpartum people every day. They have an intimate understanding of the realities facing the healthcare system and their local communities. Hearing directly from providers and the pregnant and postpartum people directly impacted by this crisis is essential. Engaging in this direct dialogue and creating opportunities both here in Washington and at home in your districts to hear directly from providers and storytellers amplifies and increases awareness about these issues, and it can help move us forward. Additionally, collaborating with different caucuses to identify intersecting issue areas, such as like abortion care, opens pathways for collaboration and helps us to grow support for the Momnibus. And as we've heard today, Congress took a critical step last year when they made the 12-month postpartum Medicaid expansion option permanent. Unfortunately, because this expansion is not required, pregnant and postpartum people in states without expanded access are without potentially life-saving care. And additionally, at least one state wants to limit access to coverage depending on the pregnancy outcome. But we know that all pregnant and postpartum people need and deserve access to healthcare regardless of how their pregnancy ends. In this moment, when threats of criminalization is heightened, we need improved protections for reproductive healthcare information. The exceptions to the HIPAA privacy rule have been exploited to require providers to disclose personal health information as a pretext for obtaining sensitive information for non-healthcare contexts. Sites like Google and other third-party websites also store this sensitive information, including our location data. These digital footprints present another source of risk because we know they're used to investigate and prosecute people. We need these stronger privacy protections for our reproductive health care data. And lastly, these threats of criminalization creates fear and distrust in our healthcare system, and it causes people to either skip or delay accessing treatment. This is why it's important for us to engage in and support efforts to decriminalize healthcare. Representative Williams earlier this year introduced a resolution to decriminalize healthcare that includes abortion and gender-affirming care. Incorporating decriminalization efforts such as these as part of the Momnibus can help us to begin addressing some of the many ways in which pregnancy and pregnancy outcomes are currently criminalized. PH looks forward to continuing being a partner, supporting the Momnibus, and envisioning opportunities to build on this work. Thank you.
Thank you, Adrian. Our next speaker is Sharnae Haywood, Senior Policy Specialist at Planned Parenthood Federation of America.
Good afternoon. My name is Sharnae Haywood, and I'm here on behalf of Planned Parenthood Federation of America, which includes our affiliates, our health centers, and the communities that we are so humbled and honored to serve. We're humbled to be invited by Congresswoman Underwood's office and to be among other organizations that have endorsed the Black Maternal Health Momnibus Act. Planned Parenthood believes that everyone across their lifespan deserves access to comprehensive health care at the highest standard, no matter their race, income, or background. That includes in the years leading up to pregnancy. The Momnibus makes substantial investments for responding to the maternal health crisis and to reduce disparities, including investing in research and evidence-based interventions, building and diversifying the perinatal workforce, and supporting the capacity of community-based organizations that know firsthand the needs on the ground. And most importantly, taking steps to address and reduce medical racism in the clinical healthcare setting, the key driver for poorer outcomes in Black women. Planned Parenthood also believes that access to quality and affordable reproductive health care across the spectrum, including but not limited to abortion access, is vital for reducing preventable death, including from pregnancy-related causes. We recognize that an individual's healthcare needs neither begins nor ends when they become pregnant. But currently, 1 in 3 women, 25 million people of reproductive age, cannot get an abortion and are facing more challenges accessing basic reproductive health care in their state. The impact of the Dobbs decision last year has led to numerous states passing sweeping abortion bans and other severe restrictions, disproportionately affecting Black and Indigenous people, people with low incomes, and underserved people in provider shortage areas that already lack access to health care. Furthermore, dozens of clinics that offer the full spectrum of reproductive health care, including abortions, have closed. Clinics that, in addition to abortion services, offered preventive screenings for hypertension and heart disease, the leading physiological cause of death for Black women. Clinics that also offer behavioral health screenings, life-saving cancer screenings for cervical and breast cancer, STI services to prevent potentially debilitating diseases such as congenital syphilis, which has seen a more than 900% increase in 6 years in Mississippi. Clinics that offer a range of services for our most underserved populations have had to shut down or had to reduce their hours. And these clinics are frequently the only source of health care for individuals and their families. Even before Roe was overturned, states with abortion restrictions where Black women are more likely to live had a 62% higher rate of maternal death than in accessible states. And this is before full-out abortion bans. Congress must prioritize the health and people of reproductive age by protecting and supporting access to the full spectrum of care, including culturally competent maternity services, but also culturally competent and compassionate comprehensive care across the reproductive health spectrum, abortion and miscarriage services, preventive screenings, contraceptive services, STI services, and other health care that improves outcomes for all individuals, including if and when they decide to become pregnant. To do this, the federal government must deepen investments in our safety net sexual and reproductive health care workforce, rebuilding and re-strengthening it, its infrastructure, to improve capacity, and to provide resources that help us and other local community-based providers manage the growing needs of the most underserved and marginalized populations. We must also ensure we have sufficient reproductive health care providers skilled at delivering the full spectrum of care. Finally, Congress must continue to center the personal accounts of people whose health are most directly affected by healthcare access challenges, to eliminate disparities and to improve outcomes across the board. Thank you so much for having us, and on behalf of Planned Parenthood Federation of America, we look forward to working with you all to advance these priorities and to improve maternal and reproductive health care in our communities. Thank you.
Thank you, Sharnae. I'd now like to introduce Elise Powell, Senior Policy Analyst at RH Impact, the Collaborative for Equity and Justice.
Good afternoon, everyone. My name is Elise Powell. I am a Senior Policy Analyst with RH Impact, the Collaborative for Equity and Justice, formerly known as the National Birth Equity Collaborative. At RH Impact, we envision a world where all Black mamas, their babies, and their villages thrive. We shift systems and culture through training, research, policy, advocacy, and community-centered collaboration. We are grateful to the leaders of the Black Maternal Health Caucus for bringing us this far and for gathering this room of key stakeholders today as we continue to push for passage of the Black Maternal Health Omnibus. In terms of ideas for garnering bipartisan support, specifically in the Senate, we'd like to suggest creating targeted state-specific advocacy materials in coalition with local CBOs to highlight the positive impact that investments from the Omnibus would have on maternal health outcomes in key member states, prioritizing states with the poorest maternal health outcomes. For the next iteration of the Omnibus, RH Impact recommends building up upon the breastfeeding lactation supports in the original Omnibus and zeroing in on solutions to expand and diversify the lactation consultant workforce, because we know the benefits of culturally concordant care. Additionally, RH Impact would love to see significant investments and funding for research to address chronic reproductive health illnesses that have a particular impact and incidence within the Black community, including fibroids, polycystic ovarian syndrome, or PCOS, endometriosis, and infertility, all of which can impact the pregnancy experience, pregnancy outcomes, and of course, overall health and well-being. Lastly, since the Dobbs decision, we have unfortunately seen an increase in instances where pregnant folks have been investigated, jailed, and prosecuted for actions during pregnancy that allegedly caused harm or risk to their pregnancies. We know that Black women and others with systematically oppressed identities are more likely to experience adverse pregnancy outcomes that place them under scrutiny of the legal system. And as such, RH Impact would recommend building out creative policy solutions to protect pregnant people and the providers who care for them from criminalization. Because being able to make decisions about your body, to have an abortion or to not have an abortion, and determine your future is essential to our collective health and well-being. And with that, I'll close with a huge thank you to the Black Maternal Health Caucus, Representative Adams, Representative Underwood, and of course the very dedicated staff who put together this event today. We look forward to continuing to work with you all to bring resolution to the Black maternal health crisis. Thank you.
Thank you, Elise. Next up is Veena Smith Ramakrishnan, who is a Senior Policy Associate at the Century Foundation.
Good afternoon, everyone. Thank you so much to Congresswomen Underwood and Adams for convening us here today. As was mentioned, my name is Veena Smith Ramakrishnan. I'm a Senior Policy Associate at the Century Foundation, a progressive, independent think tank that conducts research, develops solutions, and drives policy change to make people's lives better. At TCF, we work to promote health equity and eliminate racial and gender disparities in maternal and reproductive health outcomes. I'm speaking today also on behalf of the Black Maternal Health Federal Policy Collective, or the Collective as I'll be referring to it for brevity, which is facilitated by the Century Foundation. Founded by Dr. Jamila Taylor, the Collective is an intentionally cultivated working group that brings together dynamic Black women leaders from across the policy sector to develop strategies and solutions to tackle America's maternal health crisis. The Collective recognizes that Black women have long led the fight for health equity, particularly in the realm of maternal health, but are often too often left out of critical policy conversations. Since our inception, the Collective has been a go-to resource for policymakers, advocates, the press, and the public. As we're looking now at a divided Congress and strategizing ways to continue building support for the Momnibus, one essential ingredient that the Collective believes in is collaboration. Many before me have spoken about working in silos to the detriment of this movement, and we believe that working in coalition is of the utmost importance. The members of the Collective, many of whom you have already heard from and will continue to hear from today, come from different organizations, from community-based organizations to think tanks, to national advocacy organizations, all bringing vital different perspectives to the table. We work in collaboration with congressional offices and caucuses, administrative officials, community partners, and state-level advocates. Another key ingredient for building support around the Momnibus is making connections around issue areas. By connecting the dots between maternal health and the countless other policy issue areas, from climate change to abortion access to the economy, we can gain new support for the Momnibus and capitalize on momentum from related issues by making these connections explicit. This will allow us to grow our numbers by bringing advocates from different issue areas into the fold and bring our support to relevant, complementary issues that are part of this broader fight for reproductive justice. Additionally, as the Collective has seen firsthand, working in community with others, especially working with those on the ground who are directly impacted by the issues we're working to solve, is essential. As so many of you in this room are already doing, the Collective believes the power of connecting the grassroots to the grasstops is crucial when it comes to building support around this legislation. As we look forward to future legislation that will build upon the Momnibus, the Collective has a number of issue areas that we believe deserve attention, many of which have already been mentioned here today. One major policy we would love to see addressed going forward is mandatory 12-month postpartum Medicaid coverage. While we have been thrilled to see this coverage option become permanent last year, and we applaud the 35 states and the District of Columbia who have taken it up, we also know that until it is made mandatory, many of those who need access to care in the postpartum period will still not be able to get it. 65% of births to Black women and birthing people are financed by Medicaid, and we know that the need for postpartum care continues well past 60 days after birth, so this issue is a top priority for the Collective. And in closing, thank you so much, the Black Maternal Health Caucus, for holding space for this conversation, and thank you to my fellow members of the Black Maternal Health Federal Policy Collective.
Thank you, Vina. And last but not least, I am delighted to introduce Denise Simonette Mitchell, founder and principal of Simonette Strategies and Solutions.
Thank you to the Black Maternal Health Caucus, established for us, by us, and to the Black Maternal Health Federal Policy Collective. I am Denise Simonette Mitchell, the founder and principal of Simonette Strategies and Solutions. Established in 2020, we are a boutique consulting firm specializing in health policy and strategic advocacy. Building support to pass the Momnibus in a divided Congress is imminent. To harness our collective power in the Senate, we recommend a dual approach, preeminently cultivating champions on key Senate committees. For example, the Committee on Agriculture, Nutrition, and Forestry to help advance one of the newest additions to the Momnibus, the WIC Extension for New Moms Act. This could be adjoined by amplifying cross-cutting issues and building coalition among stakeholders with whom we can develop strategic partnerships to advance our shared causes. Accumulative to the Black maternal health crisis, we are facing an infant feeding crisis. Although breastfeeding rates in the U.S. have increased over the past decade, racial disparities continue to exist in each stage of breastfeeding, including early initiation within 1 hour of birth, exclusivity for approximately 6 months after birth, and extended duration for at least 2 years. Even more, only 10% of board-certified lactation consultants are Black. Considering what we know about racially concordant care and maternity care deserts, take a moment to consider the grave impact of these first food deserts as described by Kimberly Sills-Allers. Further illustrating the magnitude of this issue, a landmark study revealed that Black infants were more than 9 times more likely than white babies to be given formula in the hospital, thus concluding why Black mothers are disproportionately being given infant formula is a question that cannot be answered without another very uncomfortable conversation about whose babies are valued, which mothers can be trusted to feed their babies without measured and monitored amounts, and who is worthy of the time needed to help someone start breastfeeding successfully. We know that breastfeeding provides substantial nutritional, cognitive, emotional, and immunological benefits. It significantly protects against SIDS, and of note, Black infants have a 2.9 times the SIDS mortality rates of others. Additionally, breastfeeding can reduce the mother's risk of breast and ovarian cancer, type 2 diabetes, and hypertension. Breastfeeding, an important modifiable risk for both mothers and babies, is protective of maternal infant health across the life course. And as declared by the CDC, it is an investment in health, not just a lifestyle decision. As an extended breastfeeding mom and HRSA-funded doctoral training scholar, it is my recommendation that we, for the next Building Upon the Momnibus, develop a bill that advances health equity and helps eliminate health disparities by increasing breastfeeding rates among historically and systematically marginalized communities, advancing a whole-of-government approach. And on this first day of National Breastfeeding Month, I proclaim that investing in breastfeeding will advance health equity and improve maternal infant health outcomes by securing the dynamic, bi-directional dialogue of breastfeeding and human lactation. Thank you.